After we've completed the supraspinatus evaluation in the crass position, we're going to put the patient's arm into the modified crass position and then once again do a long and short axis evaluation of the supraspinatus tendon. The modified crass position also gives us a very nice look or evaluation of the cuff interval. So I'm going to ask the patient to put their hand behind as their hand is going in their back pocket. We're going to push the elbow in towards the spine. And again, our most medial landmark is going to be looking for the biceps tendon medially, which is the structure right here. Now I'm going to be moving the transducer out lateral, and we're going to be able to see the supraspinatus tendon in its long axis as it inserts onto the greater tuberosity. And we always will find the slight area of hypoechoic area, again, which is pure anisotropy. So I'm heel-toeing the transducer to show that the fibers are in contact and the bone surface is nice and smooth. Continuing to move the transducer out, again, I will see the humeral head, the anatomic neck, and the tendon of the supraspinatus. Continuing in my outward movement, now I will move out laterally and posterior, where I'll see the infraspinatus tendon insertion onto the greater tuberosity. Sliding the transducer back medially, I'm going to use both hands. I'm going to turn the transducer orientation marker so that it's pointing out laterally. So I will be looking at a short axis of the tendon. And I will move the transducer up to I see my initial bone landmarks again, which are going to be the coracoid process medially, the acromion laterally. So we're looking for the coracal acromial ligament spanning those two bone structures. And I'm going to start sliding the transducer inferiorly. So I will be getting a short axis view of the tendon, muscle, tendon, and structure. And this is where we're going to get at the area where we're going to be able to see the biceps tendon in its short axis, which will indicate that medial to that will be the area of the subscapularis tendon, and out a little bit laterally and posterior is we're going to be the supraspinatus tendon. This is the intra-articular portion of the long head of the biceps tendon at the interval which divides the subscapularis medially from the supraspinatus laterally. Continuing sliding the transducer inferior, we'll be able to see it once again the bicipital groove, the footprint of the facet for the insertion of the supraspinatus, and the middle facet for the insertion point of the infraspinatus tendon. Sliding the transducer back up, again we'll see the aspect or the area of the short axis of the supraspinatus tendon, the long head of the biceps tendon, the cuff interval, and showing the area of the subscapularis more medially. Follow that all the way back up until we pick up our bone landmarks of the coracoid process medially, the acromion laterally, and a coracal acromial ligament spanning the two bone structures.